Hi, I'm Amelia Tan. I'm from the University of Queensland, and my FameLab presentation is called Decision-Making Aids for Stroke Rehabilitation. It's a regular day at work until you get a call. It's from the hospital. You find out that your mom had a stroke and now she can't move her arm properly anymore. You're anxious, you don't know what to do, and you want her to have the best treatment possible. You meet her occupational therapist, someone who helps stroke patients to improve their arm function and get back to day-to-day tasks. Yes, let's start therapy, you think. But wait, there's a problem. There's so many therapy techniques out there, and each patient presents so differently that the therapist doesn't know which technique would work best for mom. What? If my mom doesn't get the best therapy, she won't be able to wear her own clothes or to feed herself again. Last year, that was me when my mom got a stroke. And she's not alone, because of the 500,000 Australians with stroke, 60 to 70% will have some form of disability resulting from the stroke. If you've been finding it suffocating to stay home for these few weeks, can you imagine how much worse it would be to mostly stay home for years while having difficulty managing your day-to-day tasks? Now that sounds depressing, but I'm not here to make you feel like you can no longer trust occupational therapists to do their job. No, you see, I'm an occupational therapist myself, and I'm here to show you that there is hope for our loved ones with brain injuries like stroke. So we know that it's hard for therapists to choose between different techniques, right? Okay, so maybe we can see if there are decision-making aids like flowcharts that can help therapists. But even then, how do we know if they work? My PhD investigates the effectiveness of one such decision-making aid. It's called the Hypertonicity Intervention Planning Model, or HIPM in short, and we will be examining if using the HIPM to choose therapy techniques actually improves patient outcomes. How do we do this? Well, each patient will have a fixed set of outcomes that we measure, like how much movement they have in their elbow, or how easily they can reach for a cup. Each patient will have these measured repeatedly before they start therapy, during and after all therapy sessions, and when they're on maintenance follow-up. If the HIPM is effective in helping therapists to choose suitable techniques, then we should see all patients having better outcomes after therapy, like having better movement in their arm. If so, then we know that using the HIPM as a decision-making aid can help people with brain injuries see faster and greater improvements in their arm function, which means people like my mom and people like your loved ones will be able to get back to doing the things they need and want to do. Thank you.